Hi Pedro. Thanks for coming to see me. My name's Sarah. I'm the clinic nurse at the gastroenterology clinic. How have you been feeling lately?
I've been feeling very unwell. I've had a lot of stomach problems.
Can you tell me a bit more about the symptoms you've been experiencing? What sort of stomach problems have you had?
Well, I have this awful gut pain. It's like a colicky pain in my stomach, and my stomach feels bloated as well. It's really embarrassing because I keep passing wind and I'm going to the toilet a lot as well.
When you say you are going to the toilet a lot, do you mean you've been having diarrhea?
That's right. I've had a lot of loose bowel movements. Sometimes 3 or 4 times a day.
Does the stomach pain and diarrhea come and go, or is it something you have every day?
It doesn't happen all the time, but the symptoms have been severe for the last 3 months.
Is there anything that makes the symptoms worse?
Yes. The stomach pain is usually worse after eating. If I have a bowel movement, it seems to relieve the symptoms. But nothing seems to make the bloating better.
Have you had any tests done?
Yes. I had a blood test to exclude celiac disease. I also had to give the doctor a poo sample to check for an infection in my intestine. The doctor diagnosed IBS and referred me to the gastroenterology clinic to learn how to manage the condition.
I'll go through how IBS is managed, including prevention and treatment of symptoms. The first thing to talk to you about is diet and nutrition. Following a low FODMAP diet can help reduce abdominal symptoms.
What sort of diet is that?
FODMAP are types of carbohydrates that the small intestine absorbs poorly. High FODMAP foods include cereals, beans, lentils and certain fruits and vegetables.
So, what food should I be eating?
Try to eat low FODMAP foods like eggs, meat, cheeses such as brie, cheddar and feta. Instead of lentils, try rice and oats. Some of the vegetables that are best for you are potatoes, tomatoes and cucumbers. Fruits such as grapes, oranges, strawberries, blueberries and pineapple are also low FODMAP foods.
All right. I'll try to modify my diet and see if it helps.
It's also a good idea to keep a food diary to keep a record of any food that might trigger your symptoms. Then you can avoid them.
Okay. I'll do that. Is there any medication I can take for the condition?
Your doctor will prescribe Loperamide to help with the diarrhea. The medication slows down food as it goes through the intestines. Then the body draws in more water from the intestines. This makes your poo firmer, and will also mean you'll have fewer bowel movements. Loperamide is sometimes combined with a medication called Simeticone, which reduces flatulence and bloating.
How often should I take the medication?
Take 1 tablet after each episode of diarrhea. Make sure you don't take more than 6 tablets over a 24-hour period, and don't take Loperamide for more than 48 hours without talking to your doctor.
Is there anything else I can do to help the condition?
There's a type of therapy called gut-directed hypnotherapy that's been shown to have some positive results in treating IBS symptoms. During sessions of gut-directed hypnotherapy, a therapist suggests ways to control gastrointestinal function to the subconscious mind. For example, swallowing down medication and imagining the medication is healing and protecting the gastrointestinal tract. Other relaxation techniques such as yoga can be helpful to reduce stress. Some people with IBS find that their symptoms are better if they reduce their stress levels.
That's all useful information, and it's worth thinking about having some therapy as well.